Well, hello, everybody. Welcome again to Start or Sit. This is our podcast. I'm Shannon O'Kelley, physical therapist, and joined with me is Dr. Hawkins, orthopedic surgeon, sports medicine specialist. Dr. Hawkins, how are you doing?
I'm doing wonderful today. A little chilly this morning, but ready to go over all these injuries.
Yeah. You know, it's kind of interesting. I've looked back on some of the injuries we've talked about, and I got to tell you, I mean, you're fantastic. You've essentially been spot on. What we do here with the limited sometime information we have based on the injury and the player, the discussion is, are they going to start this following week, or do you need to sit them, or how long are they going to sit in your fantasy football program? So let's get started. The first one is a high-profile running back for Green Bay, Aaron Jones. It looks like he grabbed his right knee, had a knee injury. The diagnosis right now seems to be potentially an MCL sprain. Let's talk about Aaron Jones.
Yeah, it definitely came out. It's 100% an MCL injury. That's the medial collateral ligament, the inside half of the knee. The bad news for him is this seems to be a recurring problem for him. I believe it's the third time now that he's been documented spraining that MCL. So when you sprain it, you kind of peel the ligament a little bit away from the bone, and it will heal, but oftentimes there's a little bit of residual laxity or looseness in that ligament. And so it's not a season-ending injury for him, but it's one of those things. He's going to kind of constantly tweak it. I think going into this week, he's such a bell cow running back for them that he is going to play as long as he's got good strength and good range of motion. They'll accept that he's going to keep tweaking this thing. I think his production might be hindered a little bit, but in my opinion, I think he's somebody that you're going to start him still because he's better than a lot of other choices as your running back.
Yeah, let's talk about the MCL real quick because it is a major ligament on the inside, stabilizing that knee, particularly in a player like a running back that has to stop, start, cut, change directions. Is that going to affect you mentioned maybe his output, his production. I can imagine if they're going to really go through and make sure he can do that. And the main thing is he's safe when he's carrying the ball and he can avoid tacklers if he needs to.
Yeah, they won't be able to put him in a brace like they would a lineman, but I think what they'll do is they'll run him between the tackles. They'll try to do things that are straightforward, but that'll take away, like you said, some of perhaps his lateral motion. So his usage in things like the short passing game, like screen plays where you're cutting out to the side and somebody's coming in and hitting you, that's kind of how these injuries happen. Those tacklers come in and hit you low to take you down while you're trying to get to the edge. So I think they'll probably change their package in the game offensively to avoid some of those things if he's having any type of discomfort.
What's your thoughts if that ligament is a little irritated, a little sprained, a little frayed, pulled away like you described? What's your thoughts on his ability to continue to play? I mean, he is susceptible to retweaking that and then causing more of an extensive sprain in that MCL.
I think the track record for him, I think if it was a first-time injury, they would probably actually go a little slower. But I think what he's proved to them is that he kind of knows what his limits are, and I think they will use him.
Okay, good deal. There you go. Aaron Jones, running back, Green Bay Packers. He is potentially going to start with an MCL sprain and maybe modified play calling. Ty Montgomery, running back, New Orleans Saints. The message here is he came out of the game. Sounds like his pinky finger, his fifth finger, was pointing in the wrong direction. Let's talk about that.
Yeah, it was one of those things where it blew up on the internet to show pictures of it because it really was at a right angle. And oftentimes people think that that's just going to be perhaps a dislocation of one of the small joints, usually between one of the phalanges, the smaller bones in the fingers. It turns out it was actually an open dislocation. So evidently the bone was exposed. And so that's what I think is going to keep him probably out this week because it may be something that because it's a pinky, because that involves obviously tearing some ligaments, oftentimes you can splint that or tape it to the next one over, and that will heal. But I think with having an open wound there, that might complicate things a little bit. So I think he is probably not starting this week. They have Mark Ingram that can carry a lot for them. And so I would think they might sit him for a week. There was no information on any type of surgery needed for it. So I don't believe there was a fracture associated with it.
Okay, so just the open wound though causes some concern, infection. Here you tear your skin, you open it to infection possibly. I mean, they've got to take care of it differently because it's open versus closed. Is that what you're saying?
Exactly. I think it's one of those things you'd err a little bit on the side of let's just not, if you tape it together, you go out and play, you're going to get sweat in there, it's going to get dirty. And I think that would be putting him at higher risk of an infection issue. So that's why I believe he'll be a sit this week.
He's a sit this week, but potentially, the following week, possibly if needed, he could go.
Exactly, and back into that sort of protocol of taping his pinky finger to the next finger over.
That old buddy tape system, that's a fan favorite, isn't it? I mean, when you're a sports medicine physician or an athletic trainer, physical therapist, being able to buddy tape those fingers together and using the uninjured finger to stabilize or brace the injured finger kind of works well. Okay, there you go. Let's talk about, Terry McLaurin. Let's see, he has a collarbone injury, week 9, came back, landed on his shoulder. It sounds like the injured shoulder or the collarbone fracture site or whatever the injury was on the collarbone, and landed wrong and possibly has an additional injury here. What do you think's going on there?
I think the fact that he sort of had an injury one week, came back, played, landed, and re-aggravated it probably means there's not a fracture involved here. It's probably a situation where he has sprained, or the common term sometimes used is separated his AC joint. That's the end of the collarbone as it goes away from the body where it attaches to the shoulder blade. The other possibility would be the medial or the inside half of the collarbone where it attaches to your sternum. That's your sternoclavicular joint. So those two joints, they pivot just a little bit. They don't move a lot. They've got some thick, heavy ligaments around that area. But those types of injuries, they're painful. They can restrict mobility. But typically in the NFL, those are injuries most guys will play through them. If it's painful, that is a situation where sometimes they'll actually get an injection with an anesthetic there going into a game. As long as the ligaments aren't torn, they'll play with that injury. So I think the devil will be in the details as the week goes on. If he practices, then he will probably be playing.
So potentially he is going to start this week based on how he performs. I mean, again, he's a wide receiver. That AC joint or SC joint you described, I mean, overhead mobility is important and the pain is going to be there, but they might be able to control the pain, practice him, and because it's on a significant injury, so to speak, fracture, et cetera, significant dislocation where the bones are interrupted, out of place, you think he might start this week?
Yeah, exactly. And again, they might modify how he plays. He might be one of those things where you see him catch a ball and kind of go to ground quickly before he has contact just to protect that shoulder.
Okay, we're going to talk about a couple defensive players, big-name defensive players here. And, what do they say? Defense wins championships, so to speak. I've heard that before from several coaches. I watched the game. Whitney Mercilus, pretty strong pass rusher for, I believe it's Green Bay. Yeah, had a significant upper extremity injury. What do you think's going on there?
Yeah, he came out of the game and they sort of mentioned that he had a biceps injury. So for the listeners, sometimes that's a manageable problem and sometimes it's not. So the biceps is a big muscle in the upper arm. It attaches below the elbow and it attaches up at the shoulder. So when you have these injuries where it's injured at the shoulder level, you'll oftentimes see that they came out with a biceps injury, but they'll be back playing in 1 to 2 weeks. And that's because you actually have 2 attachments of the biceps up at the shoulder. And usually the one that gets injured is the smaller one, the one that's less functional or less important, called the long head of the biceps. The other injury is down at the elbow, and that's where the biceps attaches just below the elbow, and there's only one attachment there. And so when that tears, that's almost always something that needs a surgical repair. And it came out that he was put on IR. So they haven't said anything about him having surgery, but the assumption, because they put him on IR, would seem to be that he tore the distal biceps, the bottom part of the biceps, and probably needs surgery. So if we hear in the next day or two that he had surgery, then he's obviously a sit, but he's out for the season. He will not be back until next season.
Yeah, when I was watching the game, they were talking about it was a significant injury. They showed him going into the locker room immediately. I want to kind of spend a few seconds on this because it's important that our listeners understand you can tear your biceps in two different places, what we call proximal and distal. Proximal, if you tear it up there, chance you can be fairly functional because you have two heads or two attachments. You just tear one. Distally, where it attaches to the elbow, that's the only attachment. And that is a significant area from an anatomical standpoint and functional because when you do that biceps down there, it almost 100% has to be repaired. And that is a long recovery. Let's talk about that recovery potentially for him.
Yeah, so you have to go in there and you have to reattach the tendon to the bone. There's a couple different techniques, but then you have to protect it afterwards. So essentially, in those situations, most people are going to be in some type of a sling or a support for about 6 weeks. The techniques of fixing it have gotten much stronger now, so you can start doing some range of motion, but you can't put any resistance through that for usually about 6 weeks to really start strengthening it. And the actual tendon to bone healing time takes about 12 weeks. So you're 3 months right there. And then obviously rehab and recovery. So a high level athlete, he's probably, minimum 4 months, maybe 6 months until he's going to be able to start practicing again.
And he is sitting for the rest of the season, most likely, if it is a surgical intervention, particularly at the distal biceps attachment. Sitting, right?
Correct, exactly. And so for those people who have that defense, they're not going to have production from him for sacks and pressures and things like that get you points.
Another high-name defensive lineman, Chase Young, Washington Redskins, #1 draft pick, 2 or 3 years ago? I mean, he is what I think Washington Redskins defense. I mean, he is a machine. He has an ACL tear, it sounds like.
Yeah, and he's your franchise defensive player.
Yep.
For the fantasy people out there, a lot of people expected the Washington defense to be outstanding this year because of his production. Unfortunately, the people around him have not been doing as well, but he has still been a wrecking ball, and he did tear his ACL. We've touched on ligament injuries in the knee, and everybody's heard of the ACL. Super important for stability, super important for being able to really do anything athletically. And so this is a surgical reconstruction. They will need to actually replace that ligament in his knee. And that is the classic. He's going to need 3 months of healing time, 6 months of building up strength, and then usually between 6 to 9 months of getting functionally strong again. So he, unfortunately, this is, going to end his season, hopefully not change the trajectory of his future career. He is a mobile guy, and that's always a little concerning. He's not like a quarterback coming back from an ACL, but hopefully he's such a generational talent. He will be back next season.
He is obviously sitting for the rest of the season. So if you have Chase Young, he is out. He is sitting, but we'll be back next year for sure. Dr. Hawkins, wow, again, thank you for your time. Thank you for your information. Great job. Again, I know our listeners are enjoying this conversation that you and I are having. I mean, I'm looking back. Your predictions are right on, spot on, and you're doing a great job describing these injuries for our listeners. You put it in perspective, which I think everybody can understand. Starter sit. So thank you so much.
All right, take care now.